good evening, families and friends in Stanislaus and Merced counties. This is Senator Anna Caballero, and I want to thank you for joining me on this informational virtual town hall. I also want to welcome and thank our own Congressman, Josh Harder, who is joining us today and has brief comments before we begin our call this evening. First, I also want to thank Samuel Pania, who is translating our conversation and our town hall into Spanish. So if there are any members of the public that need the Spanish translation, it's a different access code, and it should have been given to you at the beginning of the call, which is access code 2875321, and that'll be translated into Spanish. So para la gente que necesita traducción en español, hay un código para accesar la traducción que es 287-5321. Very good. So first, let me start off by assuring all of you that my first priority is your well-being, that of your family and neighbors, and that I will do everything I can to offer you the kind of leadership and support you need and deserve during this difficult time. I've worked with many of you through some very difficult times. As an assembly member, I fought alongside many of you for health care coverage for everyone and for clean, affordable drinking water. When I was in Governor Brown's cabinet, California was in the middle of one of its worst economic downturns that we'd ever faced, and I learned firsthand how important it is to have good leadership and good decision-making. And I'm proud to say that together with many of you, we worked hard and turned California's economy around when a lot of people doubted that it could be done. These experiences and many others I've had as a public servant and as an attorney serving farm workers and working families have given me a chance to build on what I learned from my parents who grew up in a copper mining town in Arizona. There were times of crisis, times when we were fearful and not sure about the future. But I learned and I saw that by coming together, by working together, we could move forward. We could see success. We could help each other and weather the crisis. I've never forgotten those lessons. Now more than ever, as I think back on all that I learned from my family and their fellow copper miners, and by all of the brave community members who answered challenges with courage and determination, the heart of any community is how it cares and protects everyone, no matter who you are or where you come from. What all of those lessons boil down to is this: when we are faced with a crisis, we need to stick together. When it's time to make decisions, we need to think and get the facts straight. And when we act, we need to act based on the values that we hold dear. So I'll be holding a series of these meetings because I want all of us to be and to work together during these difficult times. I want to make sure you have all of the facts and information you need to understand what's going on, and I want to make sure that we're acting together to protect the families and communities that we all love. So I want to thank our Congressman Josh Harder for joining us for a few minutes today, and we look forward to hearing about the actions that are underway during this difficult pandemic in our federal government. So I'd like to ask Josh if you'd like to say a few words.
Wonderful. Well, thank you so much, Senator Caballero. Thank you for the invitation, and thank you for your dedicated leadership. I think there's no question that in this crisis, Sacramento has been several steps ahead of D.C. We're trying to catch up, and I'm really grateful for all that you've done to accelerate health to our community. There's been a lot going on. I really think of this as both a public health emergency as well as a growing economic crisis. And we have to deal with both at the same time. We've got to be able to get the public health considerations under control, make sure people aren't getting sick. We're preventing the spread of this pandemic as much as possible throughout the Central Valley. And then second, we have to deal with the collateral damage that's already occurring. Folks that are losing their jobs, looking for unemployment, small businesses that are suffering without folks that are coming in, without customers, and our frontline healthcare workers that need to make sure that they have the protection and the help they need to do their job safely. And we've done a number of initiatives that have been passed and signed into law over the last couple weeks that I think will be very helpful with this, although more needs to be done. I'll talk about a couple. First is we passed a bill that I proposed for paid leave. This makes sure that everybody who has to stay home, who's worried about getting sick or is forced to stay home, has access to up to 2 weeks of paid leave, reimbursed completely to the business within certain criteria. That's a big deal because if we're asking people to stay home, we shouldn't have them not have a paycheck for that. There's also a family leave portion, and so folks can get another 6 weeks of benefit payments. That's another 60 to 70% of wages, up to $1,300 a week. So there's both sick leave as well as family leave if you have to take care of kids that aren't allowed to be in in schools, or family members that can't go out. So paid leave is a big piece. We also have changed a number of things around unemployment. We've seen unemployment claims unfortunately skyrocket because folks are getting laid off, are having their hours reduced as businesses are closing. So we extended unemployment from 26 weeks to 39 weeks, which is a long time. So you are now eligible for up to 39 weeks of unemployment benefits. So folks that lose their job through no fault of their own can make sure that they're protecting financial security. We also increased benefits and eligibility criteria. So even if you are a part-time worker or just had hours reduced, you may still qualify for unemployment. And we increased those benefits by $600 a week, which is considerable. A third thing that's going on is grants and loans and support to small business. No business plan in the country includes operating during a global pandemic. It's just not in anybody's plan. My dad runs a small business in Modesto, and he has 5 employees. He's really struggling. When you don't have customers come in for a couple weeks, it's tough to pay the bills. And we passed a bill last Friday that was signed into law that has support up to $2 million per small business to pay employees. That loan will be turned into a grant if enough of it goes towards payroll, rent, and other sorts of expenses. So I think that is a really good thing that everybody should look at if they are a business owner, if you qualify. And then the final thing is on the healthcare side, which is we're in a battle with this pandemic, with this disease. We need to make sure that our first responders, as well as our nurses, our doctors, are going in with the equipment that they need. We've had a huge shortage of masks and gloves, gowns, goggles, respirators. It is a big challenge. And this bill actually has funding to accelerate it. We probably should have done it 3 months ago. I wish we had. I was pushing for it. But this is going to make sure that we're accelerating support into our communities to make sure that they have the resources to deal with this virus if it grows in the valley. So think about it in terms of both the economic side, helping folks who are on unemployment, making sure people can take paid sick leave, helping our small businesses, as well as working on the healthcare side to make sure that the folks in our hospitals and clinics, as well as our law enforcement going out, are equipped to make sure that they can do their jobs safely, which doesn't just help them, it also helps keep the safety of our entire community in mind. So if you're interested, again, this is Congressman Josh Harder. You can go to my website, harder.house.gov. We have a dedicated coronavirus resources page on my website, but I'm very grateful for the invitation by Senator Caballero. Thank you so much to your office and what you've been doing at the state level. I think we've been really excited to have a chance to work together, and my office is prepared to do everything we can at the federal level to coordinate and make sure that our community in the Valley is getting what it needs. Thank you.
Thank you so much. And at the end of this town hall, we're going to be asking for the much-needed supplies, the personal protection equipment that first responders as well as the medical community desperately need. So thank you for your leadership in all of this. Thank you for joining us here tonight, and I look forward to continuing to do work together. Really appreciate it very much. So now I'd like to jump right into the discussion about the coronavirus or the COVID-19 and its impact it's having on our communities. And I have two goals with this town hall, virtual town hall meeting. First, it's to get good information out about the coronavirus, what it is and how it's spread. And for this part, we have Dr. Nanyonio-Kemp, a public health director of Merced County, who is accompanied by Dr. Sandoval. And they're going to explain what they know about the virus, how we can avoid getting it, how it's transmitted, what we all need to do, and what we can expect for the future. The second goal is a call to action. We're going to hear from hospital managers from Merced and Stanislaus counties who are working around the clock to get ready to take care of our neighbors who we expect to get ill from this virus and may need hospitalization. They will answer the question, what should you do if you think you might have the virus? And additionally, they are working to repurpose their facilities to quickly make decisions about who gets tested for the virus, who needs to be admitted to a hospital, and what kind of care they will need. And all of this will be new to the staff, the doctors and nurses and support staff who work at the hospital, because no one has treated a patient with this disease before. It is very contagious, and all of the staff live in our community and want to be able to go home to their families when their shift is over. So personal protective equipment, you've seen it on TV, the basic hospital supplies like gloves, masks, gowns, and eyewear for the frontline healthcare workers is extremely important. And as I mentioned at the end of this town hall, I'll be asking for donations of this equipment so that we can ensure that there are adequate protections for those people who are on the front lines to reduce this virus. There are neighbors and family members who do this important and dangerous work. So without any further ado, I'd like to introduce Dr. Nanyonio-Kemp, who is joining us here on this call. And can you tell us, Doctor, what we've learned about this extremely dangerous virus and what we can all do to avoid getting sick and passing it to others? And if you could tell us what the stay-at-home order means and why do it.
Good evening, and thank you, Senator Caballero. Yes, so I think the biggest fear that people have with coronavirus, and it is with good reason, is the novelty of it. Coronaviruses are known to cause common colds, but this particular coronavirus, we can say the severity of it is definitely much more so than what you would experience with a common cold. I think one of the dangers or one of the fears that people have just in general when it comes to the unknown is how is it going to impact me? But slowly as it's moved from the eastern hemisphere of the world to the western hemisphere, the paradigm in terms of who's impacted and who's experiencing mortality has shifted a bit. And so that raises some alarms as well. When it comes to preparation for what we should anticipate as communities, we know that here in the San Joaquin Valley, we're always under-resourced. We're always at the tail end of requesting services and supplies that are going to be required to better combat this thing. It's not an issue in California of when this is going to happen. We are at the very, very, very beginning stages. We can expect and anticipate that those numbers are going to grow, hopefully grow in a way that the curve is a little bit more distributed than what the forecast is now. With respect to the San Joaquin Valley, because we know that there are these deficiencies and healthcare amongst them, one of the things that we emphasize as health departments and just health professionals in general is the importance of preventative measures. And while people think that, oh, okay, well, yeah, I know to wash my hands, or I know that, I need to maintain social distancing, I don't think people recognize the importance of exercising these preventative measures from China to where it expanded throughout Asia to Europe to New York. One of the things that that all of these, not just health leaders, but overall country leaders have said is we should have implemented these measures sooner. Coronavirus is very easy to catch, and unfortunately the people who sometimes are the ones spreading it aren't even aware that they're the ones who have the disease. It's not uncommon that people are experiencing false negatives. That data is still being compiled. the simplest measures for ensuring that you don't catch a droplet or breathe in something that somebody has sneezed out, or you're not touching a surface that may otherwise be contaminated, is to follow those preventive-based measures. And that means staying at home, most importantly, if you're sick, maintaining a good social distancing of a minimum of 6 feet between you and another person where you can, not showing up demanding a test in your emergency room. If you're highly infectious when you're around other people, that exposes them to something that now becomes an issue, knowing that it can quickly be transmitted from person to person. Making sure that if you cough or sneeze, that you're doing so in the bend of your elbow, and you're preventing any spray from moving further. Washing your hands with soap and water frequently, making sure that commonly touched surfaces, whether it's doorknobs or elevator buttons, anything in the public restrooms or even private restrooms, that you're washing your hands and really washing your hands. Avoiding shaking hands and evaluating your travel plans. That's why we're emphasizing these very, very, very important metrics. And one of the things I wanted to share for participants on this town hall is that on our website is really robustly filled with information that we feel that would benefit members, not just of Merced County, but Stanislaus County and anybody who wants to refer to it. And that's countyofmerced.com/coronavirus. There's information from behavioral health to donations to educational materials, guidance for businesses, adult and senior care living facilities, healthcare professionals. All of our updated surveillance data and information is also located there as well. So we highly encourage people to utilize that website as a source of information, not only that, but others as well. And contact the department if they do have any questions. We do have a call center that is up and running as well. So that's what we would emphasize when it comes to COVID-19, is that we're not going to have the information now that we expect in a year, but we don't need to wait a year to put these good measures in place now. And just because COVID may go away does not mean that we wouldn't experience something very similar not long in the future. Thank you.
So, Doctor, do we know how this disease was transmitted to people in Merced?
So there are different ways or sources of transmission. Early on in I want to call it outbreak in the state of California, but early on when we started seeing cases in California, those were travel-acquired cases, so there was a known source of exposure, whether it was one on a cruise ship or being exposed to somebody who had traveled on a cruise ship. The bigger concern now is community-acquired cases, so it's either travel-related, a known exposure to somebody we knew was positive and had been around other individuals, and those individuals later became positive or tested positive. But community spread is where the largest concern lies, is that means that you may have a number that is well out of what you're guessing through the surveillance measures you put in place through your lab. The reason this is relevant for California and the nation at this point is because you hear overseas that they're doing 10,000, 20,000 tests a day in countries that are a quarter, a third, even a fifth of our population. But in the United States, we do not have that laboratory surveillance or testing capability. So every number you hear of is a guesstimate of what the true value or the true case rate may be throughout your community. There's a huge danger in not being able to rely on all sources of surveillance, whether it's clinical surveillance numbers, passive or active reporting, combined with the fact that we had the flu season at the same time we started experiencing COVID-19 in the United States. These case counts are relatively low compared to if we had the number of tests that we need to be able to identify and disrupt transmission of disease.
So it's fair to say at this point we have no idea how the first case ended up in Merced County.
Oh, the first case in Merced County was travel-related.
Okay. So that it was someone that went overseas and ended up with the disease and brought it back.
Yeah, they were on a cruise ship. I'm not sure where they were, where the cruise ship was. I actually used to be public health director for Princess Cruises, so familiar with those setups on board the ships and some of the threats that are posed just in that semi-enclosed environment. But the ship was, I believe, somewhere on the Western Hemisphere. It wasn't outside of the Americas.
Okay, and then in terms of the projections when the peak of that pandemic is likely to occur in our region? Do you have any idea, any projections on when? I'm using questions that have been sent in to us, and those are questions.
So we actually did follow the modeling techniques that were provided to us from several different academic institutions and models that were sent down from the state in preparation for our surge capacity. And we did our modeling based on social distancing and those preventative measures in place, and arrived at a value of, if by June 3rd we only had 20% reduction in social contact, we would probably in this community require a minimum of 1,018 hospital beds, approximately 400 ICU beds, and 300 ventilators. And those are only of the cases that present with extreme illness. So we would be looking in the thousands of cases if we were only to implement a 20% reduction in social contact. And that peak would be expected to be seen by June 3rd. If we were to exercise more social contact distancing, by June 15th we would require less, but we would still experience a peak, but it would be less than half of the 20% reduction in social distancing. So I guess that's an illustration to say that those preventive-based measures are incredibly important because they're the ones that influence the outcome of what you should expect to see as far as cases, and how many of those infirm cases would require further care as far as intensive care, ventilation, use of ventilation equipment, etc.
So it's important for people to understand that the more that we follow the directive to shelter in place, to stay home and to stay distant and not involve ourselves in the regular day-to-day activities that people are used to, the higher the probability that we'll need less medical interventions. In other words, hospitalizations and the breathing apparatus immediately, and that it would be it's the biggest impact that you see is on the illness and death rate and the economic devastation that it's rendering. And I say this because one of the measurements of how well we're doing sheltering in place is whether we're driving and doing our regular activities. And there's a company that has done some preliminary review, and Merced County did very poorly in reducing the amount of miles that people are traveling. In other words, people are still driving, whether they're going to work or they're going to other activities. They're still out and about way too much.
This is Dr. Sandoval.
Yes.
I wanted to add to your comments. One of the difficulties here in the Valley is that people cross county lines frequently because of work is one. For example, one of our first cases was he lived in Madera and worked in Merced, for example. So we had contacts in both counties, and that's a major problem because in our west side we have many people that, for example, commute all the way to Silicon Valley. So we've got some of the difficulty that we have with the GPS too is because it doesn't really distinguish who's an essential worker and who isn't, and many people are, for example, like in our health department we have people coming across county lines to work, so they would be contributing to that confusion. What was helpful is the fact that the governor did do the shelter at home early because mixed messages were getting out at the national level, and that really confused people, and I think it's still confusing people across the country. But people apparently here also were hearing those messages, and they were confused by that measure. But the Sheriff's Office has come out very strongly in support of the measures that the Public Health Department is recommending, and has been visiting businesses, for example, that are not complying with the recommendations. That's
great. Well, that's going to be really important. It's for people to understand that this is real serious. And your point is well taken about the essential workers, because there are a lot of essential workers in Merced County that will be going to work. But it's really important beyond that businesses close if it's not an essential business, and that people really do shelter in place, because that's the way to slow down this virus and to make sure that people are safe. That's great. Well, thank you very much, Dr. Sandoval. I appreciate you being on the phone. And big thank you to Dr. Nanyonio-Kemp as well. Appreciate your comments as well. The next doctor I'd like to introduce is Dr. Phillip Yu, Chief Medical Executive Officer at Telehealth Memorial Hospital in Los Banos. Dr. Yu, thank you for joining the call. Could you please tell us what has been done at Sutter in Los Banos to prepare for the coronavirus outbreak, and what should residents do if they feel sick and they want to know if they have the virus? What do you recommend people do?
Thank you, Senator Caballero. First, I want to actually reach out to my Los Banos and my Merced and Valley communities and tell you that Memorial Hospital Los Banos is here for you in this time of need. You may have seen, so I'll talk about some of our efforts. You may have seen our tents go up around the hospital, and these are part of our extensive surge plans to increase our critical care capacity to 2 to 3 times in a matter of days. Our teams are working really, really hard every day, and as all my colleagues are in every health system, we're all working to prepare to be able to take care of and treat those who might fall ill to COVID-19. And I'm not alone in these efforts. Our community, it's been quite amazing. Our community clinics, our City of Los Banos officials, our county public health and state and even federal agencies, we're all working quite closely together to fight COVID-19 together. And we know we're in this together. It's going to be a fight, and we're getting ready for the battle. I just want to tell you a few things about our preparations, and I hope that they might put our listeners, put your minds at ease, so that should you ever need us, know that we'll be here for you, and that when you're with us, you're part of our family. So first thing as a physician, and people in my hospital have heard me talk about this quite a lot, and that's, we start with compassion. If we're taking care of you, like I said, you're part of our family. We're here for you, and we want you to know that. Second thing is that every employee who's entering our hospital right now is getting checked for fever and temperature and symptoms, so that we make sure that we're keeping the public safe, because sometimes physicians and healthcare staff can actually be the vector by which disease is spread, and we're actually taking measures to prevent that. We know that many in our communities are likely to fall ill, so we've made extensive plans to deal with that surge, and we've already put a lot of our plan into place and actually are using it at this very moment. We've actually trained our staff and our physicians on how to don and doff, how to use their personal protective equipment. And I can tell you that they're already getting ready to fight COVID-19. I've had numerous physicians tell me, we're there with you. We're going to stand with you, with the hospital, with our medical community, and we're going to take care of our community, which is very deeply meaningful to me as a chief medical executive, as an administrator over a hospital. And we've had numerous nurses and staff, everybody down to from our doctors down to our EVS workers tell us that they're ready to fight. And now let me take just a moment to talk a little bit about and speak about testing, because that's been, as you understand, a big issue. And we understand that, when patients feel ill and believe they need urgent or emergent care, that you're going to come to us, and we're going to be here for you. And when you do come, here's a little bit about what to expect as a patient. We're going to ask you some key questions about COVID-19 symptoms. If you don't have those symptoms, number one, I'm going to be pretty happy, and you should be too. But we'll still take care of you even if you don't have those symptoms. If you do, we're going to give you a mask to protect yourself and those around you. And we're going to you're going to enter into our ED triage tent that we've set up. And that was set up so that we can evaluate you, so that we can have a medical professional take care of you, but also protect you and others around you in your community from getting COVID-19. That medical professional is going to use guidelines from the Centers of Disease Control and California Department of Public Health to evaluate you, to see if you meet the requirements to test for COVID-19. If you do not meet the criteria, we're still going to treat you and try and get you better and get you home. And if your symptoms worsen, we're still going to be right here for you if you have to return. Now, my wish is that we could test everybody. That's what I keep saying. But due to the nation's limited testing capabilities, we have to reserve those tests for those who are going to get admitted to the hospital or those who are in high-risk groups, so that we're able to take care of those individuals. Sutter Health and Memorial Hospital Los Banos, we've had a long history of caring for patients in our communities with complex illnesses, infectious diseases. And I know that I and our teams, we've been training. We feel like we're as ready as we can be to deliver and provide the high-quality health care that our community deserves and needs. And we're going to try and do that for you.
That's great. Thank you so much. A question is what's being done to assist the elderly to utilize telemedicine?
Great question.
I imagine that would be anyone that feels like that might be an appropriate solution.
Yeah, that is a great question. We found that one of the simplest things that we can do is employ iPads. And iPads tend to be actually, you hit one button and boom, you're on FaceTime. And so we've actually fought hard to get, number one, iPads into our institution and iPads into our clinics for our elderly patients so that they can do telehealth visits. We've also set up our electronic healthcare record so that it can do telehealth visits as well. So we've cleared some of those pathways. We've also I've been advocating personally to our system so that we can go out and get the materials that we need, the supplies that we need, like the iPad, and make those connections with our patients. The system itself has set up telehealth visits all across the system so that patients that are part of the Sutter Health Network can call in and get on those telehealth visits. And in the hospital, we're actually already employing, I think, about 8 iPads so that our families and patients can communicate with their caregivers, but also with their own families. So we're employing that in that way as well. They wind up being incredibly easy to use and very straightforward.
That's great. So thank you very much, Doctor. Really appreciate you being on the phone call today and appreciate your leadership in Los Banos as well. Now joining us is Chief Nursing Executive Officer Janet Ruscoe from Merced Medical Center in Merced. Nurse Ruscoe, thank you for taking the time to join this town hall. What is Merced Medical Center doing to prepare for the coronavirus outbreak? And what should residents do if they feel sick and they want to know if they have the virus? And if you could talk a little bit about what people should expect if they want to visit someone in the hospital.
Sure. First, I'd like to say good evening to everyone, and thank you, Senator, for inviting me to participate on this call and for your attention to this very serious problem we have. We have done a lot of work here at Merced Medical Center, Merced, to get ready for what we've got coming towards us. And the doctors before have both spoken to the kind of numbers that we're looking at. Here we've done the things that you're seeing, everybody, with the tents and the ED expansion as far as being able to do full exams, separate segregation of waiting rooms, temperatures on employees. I think that some of the pieces that are really important here, and I heard the last speaker discuss the iPads, how important those are, and that is a really big piece, is making sure that we're able to keep our patients and their families connected, because the separation through strict visitation affects all the patients. And so we are employing that same strategy. Additionally, our chaplains are visiting the patients and making calls to the families. So trying to keep them connected and feel supported during this time, especially those in isolation, because that's a difficult thing in itself. The other things that we're doing here beyond trying to expand our testing and get faster turnaround times in our testing, are looking to what kind of challenges we'll have, especially with patients that are recovered and that maybe our skilled nursing facilities aren't able to take right away. So we're looking at how we can expand some other areas that we have to provide a recovery zone for those patients. And then the other population that is at risk is certainly our homeless population. And we have a very good relationship with our respite care facility here, but they may not be in that position for those who might still be having viral shed. Our county does have a good, strong plan in place, and we are hopeful that comes to fruition, but we're also making some other preparations on this end to make sure that we have a solution for that challenge. I think that the PPE is obviously something that we are tracking and looking at every day. We are currently exploring sustainability solutions and have one coming, I believe, in the near future through one of our vendors at Medline. And the elective surgeries and other services have been minimized. No electives. Obviously, we're still offering acute care and making sure that we can take care of all of the patients that need attention. And the other piece here is taking care of our staff and making sure that our staff are safe and feel safe, and that they're here to take care of the community.
So the PPE you're referring to is the personal protective equipment that the nurses and the doctors and the support staff use to keep themselves from risking infection. And we'll be asking the community to help. It's unusual. That's not the way the hospitals operate, but it's more important to have the equipment right now available, given that it's in short supply.
That's correct, and so we're also trying to project ahead and solve for the next months ahead of us, and so that we have something that will keep us from hitting a critical point of not having enough.
So if someone ends up in the hospital, the family should expect that they won't all be able to show up at the hospital and visit. It'll be restricted, and in some cases they won't be able to show up at all if the individual has symptoms of coronavirus or tests positive. I take it.
Yes, that's correct. The visitation is very limited. For birth, there's ability to have one person that the mother identifies to have with her. At end of life, another individual that can be there, and then on a case-by-case basis and with guardian situations. So
if individuals want to be tested, they will show up. Their best the best advice is to check in with their doctor or their medical provider and explain what the risks are, and if they have symptoms, may be referred to your location to go through a protocol.
Yes, we do. We have tested patients that were tested and yet still leave as an outpatient from the emergency department. As stated before, testing is limited at this time, so most of the testing then on is patients that are being admitted and that have significant symptoms. But we have done some outpatient testing, but they can come and be seen and get a full medical examination and be checked out. And we do have a comfort kit for them so that they're not out and about back in the store trying to buy Tylenol and cough syrup. So we're providing that for the patients that are being sent home that have their respiratory symptoms.
That's great. That's great. Thank you. Thank you so much. Appreciate you being on the call today and all the work that you're doing. Thank you. We're going to move on to talk with Mr. Diego Martinez, who's the Chief Strategy and Compliance Officer for the Golden Valley Health Center. It's located both in Stanislaus and Merced County. Mr. Martinez, thank you for joining us. Could you please share what preparations for COVID-19 has been undertaken at Golden Valley, and what your patients should do if they feel sick, and how can new patients sign up for your services? Mr. Martinez? Are you still on? Going once, going twice. Okay, so we'll move on to our next speaker. Mr. Martinez may have had to leave us, and so we'll see if he calls back in. And we'll move on to Dr. Flores, Dr. Alain Flores from Kaiser Permanente in Modesto. Thank you for joining us and for taking the time to talk to us about your services. Obviously, your services are part of a member health plan. So please tell us what you've done to prepare for the coronavirus outbreak, and what should Kaiser patients do if they feel sick and they want to know if they have the coronavirus.
Thank you, Senator Caballero, for allowing me to share. First of all, I want to say to both our Kaiser Permanente members as well as our non-members that we're here and open for our community. They can get some additional information from what I'm about to share at our website at www.about.kp.org if they want some additional information. That's www.about.kp.org. So first and foremost, again, we're here for our members who need medical services. Everyone should know that our hospitals as well as our emergency departments are open and they're caring for severely ill patients. Our outpatient strategy has been to reduce traffic through our medical centers as much as possible in order to reduce the spread of the coronavirus. So we have instituted what we're calling a telehealth first strategy. So our care starts with our members from their homes. So what they do is if they feel they're sick or they have some sort of medical condition, it may be COVID, it may be arthritis, it could be anything, both routine as well as urgent care, our members will access the care through one of our call centers in Northern California and by calling the number on their medical card. And from there, they are going to be scheduled into a telephone visit or a video visit with a physician. That physician will assess their concerns, maybe perform some additional testing or screening tests that might be necessary, and they may provide treatment right on the spot over the phone and video. We do have a dedicated regional COVID triage line where if we're speaking with a patient who we suspect may have COVID and may need testing, we're going to ensure that they meet the testing eligibility criteria, and if so, that they will be scheduled an appointment at our Modesto Medical Center
where we have a drive-through COVID testing site set up. The patients will be contacted by a coordinator, will actually be given a specific time of when to drive there and to have their swabs taken. Additionally, those test results have a turnaround time of 24 hours at this point in time, and we have a regional call center that will relay the results to the patients by phone. If they're negative, they'll be given some additional information on how to continue to self-monitor their symptoms at home, and if they're positive, they'll be connected with a physician who will give additional treatment recommendations. I also want to let folks know that at our medical centers, we have instituted a single site entry program so that when patients drive up to Kaiser, they will be directed by a parking attendant that will separate patients and employees to specific parking areas. As patients or employees walk up to the medical center, they will be greeted by a member of our staff who will perform some screening questions to ensure that we separate patients who have potential COVID symptoms from our general population. Those that may have symptoms will be brought to a treatment/isolation area where a physician will actually call that patient on their cell phone, assess their symptoms a bit further, and if the doctor feels that they're safe to enter the facility, they'll be given a mask and they'll be on their way to their next appointment or to the pharmacy or to the lab, wherever they might have been going. If there is some concern, that patient will be taken to an isolation area where a member of our team who with proper PPE will evaluate that patient. I also want to share that our Kaiser Pharmacy Services has also changed our program in order to limit traffic through our pharmacies. So we are promoting our mail order pharmacy services for both routine medication refills as well as non-urgent new prescriptions. For those patients that need urgent medications, we have developed a home delivery service, which we've contracted with an outside courier service, which will actually take medications to patients' home who are alone, have no other healthy members who can pick up the medicines at the pharmacy, and this will provide that urgent medical service for them. And then lastly, I want to let folks know that our member services and medical records office have also transitioned to their processes to support our patients who might need medical records or forms or letters for their employers for being off work. They can be accessed virtually through kp.org or through email. And so we're here for our members to support them during this trying time.
That's great. So you've really perfected the telehealth platform to be able to have people take as little of their time, but spend it talking with a health professional to get their questions answered right off the bat.
Yes, and definitely. We've been doing this for a few years now, and so this we were well prepared during this time where we had to really put all cylinders to telehealth, including our specialty departments. So even our specialists, whether it's our oncologists, our cardiologists, even physical therapy, even our psychiatrists and therapists in mental health, all providing care through telehealth services at this time.
That's great, because that's one of the issues that is really critical in rural California, is to avoid people having to get in their car and drive a long distance if they don't need to. If they can get help right away, first of all, as they may not have transportation, but second of all, that to be able to access the information right away is really it's important, and if it works well, both for the patient and for the doctor, it saves the doctor as well, because you're not likely to be late if it's a telephone call, as opposed to getting on the highway and never knowing what the traffic's going to be like. That's great.
Absolutely.
So you mentioned the testing, and there's a question here about of who gets tested and, how quickly you indicated a 24-hour turnaround. There was some discussion that there's a quick test that will tell you within an hour that whether you have the coronavirus or not, are those tests not available widely, or is California or the Central Valley likely to see those tests come online at some point?
Yes, so there is a new machine that's coming out that will be probably distributed to many health plans around the country. It's going to be a game changer that will probably allow us to do rapid testing at individual facilities. I don't know if anyone in California has it yet. We don't have it in Kaiser Permanente as of yet, but I know that we will be getting them. For our facilities will be dedicated specifically in the laboratory. I don't know if we will definitely have it in Modesto, but whether it's going to be in every Kaiser facility, I don't know. But it will definitely be a game changer, and we look forward to being able to provide that service very soon.
That's great. Very good. Well, thank you very much for joining us here today, and thank you for sharing what you're doing for your members. It's really important that people know what they should do if they have any questions. So thank you for that. I understand that Mr. Diego Martinez is on the phone again, and he's the Chief Strategy and Compliance Officer for the Golden Valley Health Center, which I indicated before is located both in Stanislaus and Merced counties. Thank you, Mr. Martinez, for joining the town hall. And could you please share what preparations for COVID-19 Golden Valley has undertaken, and what your patients should do if they feel sick, and then how can new patients sign up for your services at this time?
Sure. So first, let's make sure. Can you hear me?
Yes, absolutely. Can do.
All right, great. Good evening. Thank you very much, Senator, for having us. Yes, we have a lot of health centers up and down the county, and they're open to see patients. We're a primary care provider, and what we're doing is basically, as a federally qualified health center, we need to have patients registered in order to receive the services that we offer. So one of the easiest ways is for patients to call our telephone number, 866-682-4842, and that way they get information. So what have we done? We have 2 drive-thrus. We have one in Merced County, and we have one in Stanislaus County. The one in Merced is at our Child's campus, and the one in Stanislaus is in our Ceres Whitmore campus. So the second thing that we've done is we've implemented telephone visits so that patients feel a little more at ease in discussing their medical components with a provider at their homes, and we're able to address any kind of needs, whether it's prescriptions, any labs, or any kind of issues or questions that they have with regards to this disease. The third thing that we've done, and one very important thing for everybody to know, we've separated our clinics into sick and well clinics. So it's really, really, really important for somebody to call in ahead of time to make sure that you end up at the correct location. No matter what, we'll still have triage facilities at the front of our facilities to make sure that we don't have any sick patients coming into our well areas, and they're routed accordingly. We also have behavioral health as a component, a very important component available for the patients, and our basically our call center is open from 7 in the morning to 6 p.m. To answer any questions that anybody may have. Let's see. So what will happen is anybody that calls that is not a patient will get a mini registration and get sent to a health center in order to sign and get all the paperwork corrected and be seen at that health center. Now, that depends on availability. Right now, there is availability for patients to be seen, so that's pretty much it.
So do you do the testing at your location, or do you refer individuals through the county public health department? How do you do it, the testing there at the clinic?
Sure. So what we have is those two facilities that are set up for testing, those drive-throughs, is where we test. When the patient calls in, they're triaged and they're asked a few questions, and then they're directed, if they have any of the classical symptoms that are reflective of this disease, they're directed into those drive-through health centers to get tested.
Okay, and I'm assuming you've got the same protocols for determining who gets tested and who doesn't, in terms of exhibiting certain symptoms?
That is correct.
And then the same turnaround, it takes a period of time before you find out whether the individual has COVID-19 or not?
Yes, we send out all of our testing to our labs. So right now it's taken between 5 to 7 days, depending on the lab.
Okay, and these are labs here in California?
That's a very good question. I don't have the answer for that. It's LabCorp.
Okay. I just wondered because I thought the labs in California were processing them a little bit faster, but we can offline check up on that and see if that's the case or not. One of the questions that was asked, and it's probably kind of unfair to ask. You're the last one on the phone, so it's kind of unfair to ask you this, but it's I think it's a feeling that is shared. Generally, which is that the Central Valley has long suffered a doctor shortage, and Merced County in particular is impacted because of this, and that this epidemic will be a stress test to the Central Valley's already fragile health infrastructure. What steps will be taken to ensure that not only District 12 constituents will be seen in a timely manner, but that the healthcare workers stay healthy and safe as they battle the pandemic? I think there's real concern. I know that the legislators in the Central Valley have been really working hard to expand the opportunity for UC San Francisco to have a satellite campus both at Fresno State and at UC Merced, so that doctors can get training here in the Valley and not have to get the training at UC San Francisco. But that's long term. It doesn't solve the shortage right now. Maybe you can make a comment about some of the challenges or opportunities that you see.
I can't speak for the others on the phone, but I can speak for us. Yes, there's definitely challenges in bringing providers here. I think the most important thing that we bring to the table, just like you heard from others, is having enough protective equipment, personal protective equipment to basically guard our employees against contacting the disease. And I think that the piece that it's probably impacted the most for us has been the dental area, because basically dental's not allowed to do anything except emergent services. But as far as our providers and our doctors, they're all hands on deck, and they're all right now doing what they need to do, first of all, by telephone calls, which is one of the safest modes of discussing their health care. Telehealth is the second one. And then the triaging of, as I said before, the sick and the well clinics, and referring patients to the correct locations to minimize the infectious process. But challenges to bring providers to the Central Valley, I'm sure everybody on the call faces that, and I'm sure there's also as many creative possibilities as well.
Well, I that's probably the best wrap up and introduction to my final plea. Thank you, Mr. Martinez, for getting on the phone call and for participating, and thank you for all the work that you do at Golden Valley, and for organizing it in such a way that you maximize people not coming into contact with the COVID as they come in for services, and also protecting all of the healthcare workers that are making it possible for people to survive this terrible disease. Thank you very much for joining us here today. Thank you. So we had questions emailed to us prior to the call, and many of them have been answered. We tried to fit them in where they made sense. Sorry if we didn't get to all the questions, but this won't be the last town hall that we'll do, so let's stay in contact and let me know what information we should focus on next. I want to do one on mental health because I think it's really important for us to all realize the impact this has on our relationships with each other as we're all at home, and also on how hard it is at times to stay home. It's interesting that it's so hard. But we're nearing the end of this scheduled call, so I'd like to thank all of the speakers who joined us this evening. You are the community heroes, and we appreciate all your hard work and your dedication to making sure that we have good medical services in our community. And many thanks for all that you're doing to keep us safe. I'd also like to thank Congressman Harder for joining us and for organizing the Central Valley PPE collection efforts. PPE stands for personal protective equipment. I almost forgot. And this equipment is really, really important. At the beginning of the town hall, I said that my first priority was your personal well-being and that of your family members, and that is my pledge. But I can't do it alone. It takes you and your families and your friends to participate with a shelter-in-place or stay-at-home order and your commitment to vulnerable members of our community. And we can do this together. As your senator, I'm committed to action. And I heard loud and clear over the past few days that the first responders and the medical providers needed supplies to keep themselves safe from the virus. So I'm looking for donations, and medical offices such as chiropractors, dentists, and surgery clinics may have medical supplies and personal protection equipment that are not being used and can be donated. Carpenters, electricians, and people who work in the construction industry or are in the trades may have masks and face protection equipment as well. If you have any of this equipment in its original unopened condition and would be willing to donate it to help our healthcare workers, please call my office at 209-726-5495, and we can arrange a pickup. You can also email my district director, Anna, A-N-N-A, Velazquez, VELAZQUEZ, at sen.ca.gov. And again, we can pick up your contributions. There are also 2 locations where you can take these much needed supplies. They're masks, eye protection like plastic face shields and non-ventilated goggles, disposable surgical gowns and gloves, medical thermometers, antibacterial cleaning wipes, and ventilators. And the 2 locations, one in Modesto, is the Crosspoint Community Church, located at 1325 12th Street in Modesto, and in Merced, the Salvation Army, located at 1440 West 12th Street in Merced. Both of these locations can take drop-offs, and we can schedule pickups so that we can collect this information. The audio of this town hall will be posted on my Senate website and through social media soon, so you can listen to it again and get those addresses. And if we all work together, we can be better prepared to fight this grave disease together. This concludes our town hall broadcast. Thank you for joining us. Be safe and stay healthy, and thank you again. Much appreciated.